very sincerely those of you who've found time in your day to come to this launch. We're really very proud in Sydney Local Health District to have Pozhet organisation, Positive Heterosexuals, working in our midst, and that goes back a very long time. And looking around, I see quite a number of people who've had quite a lot to do with the organisation in former years, and we really want to thank everyone who's come from their various organisations to be present today. We really think this is an important day for staff and for the clients of Pozhet, and I want to, as you've just heard, there's been a lot of work going on over 2 years or more, which has really culminated in the sort of resources that you can see on the table there in the corner of the room, and more importantly, the living resources that are on the website. But to get from the project, from its plan to its reality, has required involvement of a very large number of people who've shared their knowledge and their experience, and indeed have shared their passion for working in this field. And the product of that is what you see, and I think you can be pretty confident that the product will continue to develop and that the product will get better and better. So you've heard of the efforts that have really been undertaken, and Rachel, Maxine, Susan and Peter were mentioned as people who have contributed a lot to the most recent iteration, but before them they follow a series of people who've really put their heart and souls into this work. So the resources that are actually being launched today are the Pozhet website, and for anyone who's not sort of immediately aware, I haven't visited the website, it is Pozhet. There is no S in it, and that is .org.au, and it's, I think, cycling through on the screen. I'm not sure what's cycling through there. I expect that's what's cycling through right through. The other things that are being launched is the new service pamphlets, and indeed the new logo branding, and some pamphlets which are, I think, really very much needed, and I hope will be taken up widely. Certainly I intend to make them very well known to medical students coming through in the courses that I have anything to do with, as well as obviously to our clients and to families who ask. And one of them is entitled Life, Loving and HIV, and also a second pamphlet which is entitled Having a Baby. And there's copies of both of those over there on the table. But before I say more about the specific new resources, I just want to remind all of us just how this story has unfolded, how Pozhet's past and present have melded. And it's a story really about an effective community response to a problem and the health system's response to the community initiative. It's a story that we can all be proud of now, but there was a time when things were more difficult, and it was really out of that period of difficulty that the community responded and the organisation was developed. It was originally there for a community-based organisation, grew from very humble beginnings in the early 1990s, and remember that really was the darkest days of HIV. Treatments were available but not very effective, and our hospital beds were filled and overflowing, and the picture that was in the community was a very grim picture. And it's developed now, of course, to be part of mainstream health services, with a very close alignment to the clinical services provided by Sydney Local Health District, other local health districts, as well as the services provided by the non-government sector. And that partnership has been a really important part, both in developing the resources but also in their future utilisation. So the service started in about 1993, and it was initially a volunteer-run support group. It was initiated by an individual man who was heterosexual and who made it known he was HIV positive, and he felt from his own experience there was a lack of services in New South Wales that to meet the non-medical support needs and the information wants of heterosexual people with HIV. Not that there weren't some existing services at that stage, but they had very narrow focus. There was the trades unit, which was organised out of, principally out of Westmead Hospital, which was for transfusion-related HIV and AIDS. And there was a support unit built around people with HIV, with haemophilia, and most of their clients were heterosexual. But they were very narrow focused groups. And what was being identified is that there wasn't actually service supports which were there for the others. And indeed those services were inadequate. And since that time, of course, we've moved from a very small community-based support group with an initial budget, I think, of $60 a week, to support their activities, to an organisation that's now operating well and truly within a health service and which has the resources available to it that really couldn't have been dreamt of in the early 1990s. It's one of the few HIV services in Australia that's dedicated specifically to the needs of heterosexual people living with HIV and to those providing support to those people. And I really want to emphasise that. When I made the comment that I intend to make these resources really well known to the medical students and young graduates, etc., it's because people trying to support people with HIV, whatever their mode of acquisition of HIV, in our current environment where there is a lot of detailed information out there, but also a lot that's old and wrong, their information needs are quite great. I think in this sort of audience there'd be very few, if anyone, who wouldn't be aware that the majority of people living with HIV acquired their infection at some time in the last 35 years from homosexual unprotected sexual contact. That's the majority. I expect also this audience would be only too familiar with the reality that the number of people living with HIV in Australia is continuing to steadily rise. And that's partly the result of the impact of treatment, which thankfully has resulted in very few deaths occurring and now long life expectancies on treatment, coupled with a probable increasing rate of new infection over the last 15 years. And this has actually meant that the HIV positive community is now one which is still expanding numerically, and one which has to deal with the effects of HIV in ways that really weren't thought of or thought likely a few decades back. And those comments apply equally to those with HIV, whether they are homosexual, bisexual, heterosexual, or whether they're male or female, or whether they acquired HIV from sexual contact or otherwise, such as from injecting. The reality is that everyone involved in HIV is dealing with an ever-changing landscape, and no one can afford to rely on outdated information. What the medical community told our patients even 5 years ago about mitigation of transmission risk, about pregnancy, about childbirth, about lifespan and about health expectancy, those things have had to be remodified, reanalysed and represented to the same people that we have been advising years ago in the context of what we now know to be true rather than what we hoped would be true. So science has delivered the social and biological research and that's really involved a large contribution, huge contribution of people in many facets of HIV to undertake the studies worldwide, and from that knowledge we now need to move forward. So it's generally a very good news story that's deserving to be told effectively and with confidence. And whilst the messages are increasingly reaching the gay community, getting the information to the heterosexual community with HIV is paradoxically a potentially more difficult and more complex task. The reality is that about 20% of new diagnoses occur in those who identify as heterosexual. In New South Wales, and this is in Australia, in New South Wales and Australia they're the minority, though as you'd all know on a global scale they are the majority. Unfortunately, despite the best efforts of national and state public health organisations in many countries, NGOs, AIDS councils, the medical education industry, and global organisations like UNAIDS, Gates Foundation, MSF, sectarian workers, the epidemic continues to grow, and the bulk of newly infected people are young, sexually active heterosexuals, many who are living in serodiscordant relationships at the time of their diagnosis. and their needs for reliable information about HIV have never been greater. Many of you I know were at the recent International AIDS Conference in Melbourne, and there, in the many presentations and posters, we were continuously reminded of the low levels of HIV risk awareness in the general heterosexual population. I think it's fair to say that no country has achieved the levels of knowledge and health-preserving behaviour that are needed to curb HIV, though clearly some countries are doing better than others, and some cities within countries are doing better than others. There's indeed great urgency in getting information about HIV to those with HIV and to those at risk of acquiring it. And that need provides a big challenge, irrespective of the country in which it's occurring. Meeting that challenge requires huge efforts, creativity, government support, political will, all in the context of community mobilisation. Both locally and internationally, heterosexual people living with HIV have highly variable levels of general education. Many are in paid employment, many are managers, educators, manual workers, many are students and homemakers. They're also in marginalised groups such as sex workers and people who inject. They come from a range of backgrounds and they have really diverse social and living situations. There's no stereotype that applies to them. Some acquired HIV through practices which they recognised at the time to be risky, whilst others saw little risk or no risk in their activities at the time. In retrospect, their risk may be evident to us now as unprotected sex, unsafe injecting, receiving blood products before the advent of screening, being a child to an HIV-infected mother who was untreated, and so forth. But after the event, after diagnosis, their focus sensibly tends to be on the future, not the past. So putting HIV into the context of stable, monogamous relationships or new relationships, or into the context of people seeking such relationships, provides those living with HIV and their care teams with some significant issues to work through. And that process can certainly be facilitated by engagement with Pozhet. So the point of what I've said in the lead up to now is that all of this is really to highlight that there's no stereotype for the people that may visit Pozhet, whether they visit it in the flesh or whether they are accessing it through the internet. And so the services really have to be quite broad in their interest level, and they have to really meet a lot of needs simultaneously. And one has to be really delighted to see the platform that their resources are on to be accessible to people in other states, other cities, other countries indeed. And one will expect that these resources will get used by people, internationally in ways that we really haven't envisaged. So the ways in which Pozhet undertakes its work has been both developing resources but also to ensure that there's advocacy around heterosexual HIV and that the issues that come to light through the engagement with individuals and hearing the stories and working with the clients, that those the learnings from that actually are reflected in strategies. And indeed what Pozhet does in its work is reflected in international, national and state HIV strategies, including the current Australian and New South Wales strategies. Pozhet has a really good track record in consistently working in partnership with other agencies around New South Wales, and we're obviously delighted to have such a good representation of people that have assisted in that over the years. And currently Pozhet is in the final stages of developing a strategic plan which should be launched next year. We'd like our staff to have just a little bit of a rest, having done all of the work that has got things to this stage, and then to springboard forward into really tidying up the final parts of the strategic plan to make it available for launch. So this launch is, as I said, a very, very pleasurable one for anyone who's been associated with Pozhet. The event showcases the hard work that's gone into redeveloping and reorienting the services to make it more equitable and more accessible to clients that live in New South Wales but also nationally. The obvious move to more web-based services you can see, and the reach is now going to be really much greater than it has been in the past. The formats that are being used include YouTube clips, interactive quizzes. I'm happy to say I passed the quiz. And I was very worried. It was anonymous, but I was still worried. And the various articles that you see ensure that it appeals to people from a range of backgrounds and with a range of literacy levels. The booklets also address important topics for heterosexual clients, and I think we're going to see a lot of use made of the Sero-Discordant Heterosexual Relationships brochure, because that really is the only resource in Australia of its kind, and we've had great demand for that, and it really does encapsulate the up-to-date information that people are being given in clinical context. So before handing over to our next speaker, I really want to thank again all of you who've supported Pozhet in getting it to this stage. Thank you for attending today. Really want to make that a very sincere thank you.